right, we are back on the Lightning Step Couch here at Global Exchange 2023. Sitting to my left is Gary Garth, the founder and CEO of Elevate.io. That's ELEV8.io. We are headquartered out of Tampa, Florida, with locations in Colombia, or you've got some business in Colombia as well.
Yeah, basically, we got 60-70% of headcount in Medellin, Colombia.
Okay, awesome. Can you tell us a little bit about Elevate and what you do?
Absolutely. So we're basically 360-degree solutions for addiction treatment centers and mental health centers. In a nutshell, we help them drive census, reach full census. We do that via everything under the sun from a marketing standpoint. We're very, very good at PPC, SEO, etc. So we generate the leads. Subsequently, we make sure they don't fall through the cracks. So that's by CRM and tech enablement. So whether that's an integration with your technology or everything from Salesforce to Keepu, we're call tracking metrics, just making sure that all the flows are set up and we have the proper reporting and attribution. And then last but not least, we also help them with the sale admissions enablement. So basically, we have like a BPO service where we help them answer calls, help drive admissions. We do outsource BDR work and basically make sure that we fuel the BD team's calendar with tons of referral and meetings, etc.
Absolutely.
Yeah.
How did you get into this, Gary?
Yeah, interesting question. So I'm a serial entrepreneur. I worked 15 years very closely with Google and Microsoft, ran one of the largest agencies in North America. PPC focused 300 million on the management annually. Just sold that agency in 2020. I was tired of working for personal injury lawyers, bankers, and mortgage companies that spend a lot of money on Google. And simultaneously with that, my best friend had an OD. I had met some folks in my family had a lot of problems with substance abuse, and I was like, let me. How am I making the world a better place? So I invested into 2 rehabs. One in the luxury boutique rehabs. One was in the Dominican Republic. The other one in Canada.
Okay.
And that was unfortunately February 2020. So we had like 10 months of travel restrictions, and I burned through $1 million or so. But it was maybe a blessing in disguise because I was interviewing all the folks that was going to help us, fill all our beds. And I was there's a lot of good folks out there, but I was not particularly impressed with the strategies. There was no concise, what's our target CPA, what's the cost per VOB, what's the milestones and projects. And having worked for other marketing agencies and with Google and Microsoft for 15 years, the bar was set pretty high in terms of how to do that. So I was like, wait a minute, why don't I take those resources, those experiences, and then apply that and help other facilities do what they do best and get to full census? Because the statistics of so many people suffering from addiction, and there's still being a gap of not all centers being at full census, just blew my mind. So it's like, okay, that's basically comes down to effective new patient acquisition strategy.
Yeah, marketing campaigns. And marketing for behavioral health can be a touchy topic. We want to keep the census full, but we don't want to look at ourselves as driven by money, or we're there to care for the patients. How do you navigate that touchy landscape?
Well, I would say, like any entrepreneur, philanthropist who wants to make an impact, understands that profitability comes first. Without that, you can't reinvest, you can't innovate, you can't do R&D. So I think that the most savvy facilities we work with, they understand that. Obviously, they have a clear separation and they have certain, a high integrity and everything is in place. But at the same time, let's make sure that we help as many people as possible. But I think where people have a bad view in marketing is that there's so many shady players. There's like all these lead aggregators where they sell calls to facilities. So it has a bad rep. So we go in instead and say, okay, let us help you as a center. Instead of buying those kind of services, let's help build out your marketing department, your intellectual property. Let's make sure you understand who to send the message to at the right time and how do they become patients in you and the right patients. So it's a hard topic to break down in 10 minutes, but I work with facilities that say, let's target these states, these household incomes, these zip codes, Let's focus on these insurance types. These are the best policies that allows us to provide the best service.
Okay.
So that's how we craft a plan. We go out and hit it, and we report and optimize based on that.
That's awesome. Yeah, it's marketing and getting those beds full is very important for the business aspect of this. And people aren't always pushing a lot of energy within their organization towards the marketing aspect of it. How can people find you so that they can better their business?
Yeah, go to elevate.io, elevate with an 8.io. Look up my personal profile as well, Gary Garth. Hit me up. I would say where we differ and why you should contact us is we focus not we basically don't just focus on the marketing aspect of it. Like I said, we work with the CRM tech enablement. I have 15 years. I wrote a book on sales that is endorsed by the head of sales at Google, Microsoft, and Amazon. I'm not trying to put out names out there, blow my own trumpet, but
That's all right.
a big part of it is
Yeah.
like if your conversion rates are not good,
Yes.
and that can be for a lot of reasons. The typical scenario is marketing is pointing fingers at the missions team, say they suck, they don't answer the calls, they don't follow up, and the missions team said you're sending us crappy leads. Once you integrate those and have a unified strategy, it's not two siloed departments, magic happens. So that's how we like to work.
Absolutely.
And making sure we check off all the boxes so that we get to a profitable CPA.
Absolutely.
Yeah.
Yeah, Global Exchange is a great conference, not only because we're right here in Disney, but because it brings a lot of beautiful minds together. What are you trying to gain from GXC today?
Meet a lot of folks, learn a lot. There's a ton of skilled professionals. I'm still rather new to the industry. I've only operated 2.5 years in the behavioral health space. I've gone all in, so I would say I'm accumulated a lot of knowledge, but I'm still looking to just interview subject matter experts, folks that's been in this industry 20, 30 years, pick their brain, learn what's moving the needle, and try to see if there's any particular patterns that we can identify and then double down on subsequently.
Absolutely, absolutely. I think keeping those beds full, keeping the census high is really what we want to do. So I encourage everybody to check out elevate.io. Again, we have Gary Garth sitting next to us, founder and CEO, based out of Tampa, Florida. Gary, I appreciate your time today on the
Pleasure, man.
couch. Enjoy your time here at GXC.
Thank you very much.
Thank you.